This exercise is a VOR, or vestibular ocular reflex, and we're going to specifically focus on what we call VOR times 1. So that means our head is going to be moving and the target is going to be still. So we do usually a few different types of exercises for this visual and vestibular system. One would be the smooth pursuits, where your eyes are following a moving target. Another would be the saccades, where you have two targets and your eyes are bouncing between the two targets. Another would be the VOR, which we're going to do today. So that's that head moving and that eye staying still. And then VOR cancellation, which would be moving your head and the target in sync with each other. So for VOR times 1, we're going to start seated with the back supported. That's a little bit less to worry about in terms of balance and stability, especially if this makes you feel dizzy. It's a good place to start. So we'll hold that out at arm's length, or have a little dot taped to the wall at a comfortable distance from you that you can see. And then you're going to turn your head. Now, in terms of how far we turn our head, if I close the eye that's closest to that target, around here I've already lost that target with this eye. We really want to try and stay in that binocular field where both eyes can see the target. So really it's a small head turn, right? It's like maybe 10, 15 degrees in each direction. So about like a 30-degree arc, maybe a 40-degree arc, not big head turns. So what'll happen is one of your eyes will lose focus on that target because it's hitting the nose. And then it's going to mess with the ability for your eyes to kind of work in the way that we're designing with this exercise, okay? So a small head turn, shake your head no in a subtle way, or if we were doing vertical, we could do shake your head up and down. If you can coordinate it, you can do a diagonal. You can do a diagonal in the other way, but that gets kind of challenging just from the coordination of it. Starting usually just horizontal or just vertical. Speed, we can bump up the speed a fair bit on this. When we test, we usually try to shoot for a pretty quick pace like that, okay? Starting with the exercise, we're going off of your symptoms. We don't want you feeling way worse after doing these exercises. We're trying to basically acclimatize your body to the stimulation and make it know that it's okay, and practice getting better at it. If we completely overwhelm you, it's not going to get better. You're just going to get worse, okay? So careful on the dosing there. That's that VOR times 1. You can also practice that as it gets better. Back unsupported, standing on one leg, half kneeling, tall kneeling, lots of different positions that you can practice these things in.